Welcome to the Northwest Activity Center. As you can see, one of the really fine facilities that we operate here in the city of Detroit. I'm very honored to have President Obama's Secretary of State, Kathleen Sebelius, joining us here today, as well as the person who I suspect you will see will be the star of the show, Ms. Lanika Wise, who's going to talk about how easy it was to go online and register for health care coverage and how much of a difference it's made in her life. The interesting thing is the Secretary and I had dinner when she was in Detroit in November, and at the time she was the most besieged woman in America, if you remember. Every place she went, all she heard was, why can't we enroll? And I thought I was going to see this depressed, beaten down individual. She was as happy as could be and calmly took me through, here's how we messed up, here's the steps we're going to take to fix it. In December, all kinds of people are going to enroll. And I thought, that's amazing, I hope it works out. And then in December, more than 3 million Americans, including 75,000 people from Michigan, including the young woman you're going to hear from today, enrolled under the Affordable Care Act. So think about this, 75,000 of our neighbors in this state, most of them have health care coverage for the first time in their lives. And with what's coming on April 1st with the Medicaid expansion, there is going to be another 65,000 residents just of the city of Detroit eligible for health care coverage. But of course, it's so confusing, people don't really understand it. And so we have brought together a group today that the Secretary has organized of nonprofits and public health agencies and healthcare providers to figure out how we get the word out. And for somebody like me, who spent 9 years at the Detroit Medical Center, where we see more than 300,000 patients a year in our emergency rooms, and my friends at St. John's and Henry Ford and the other systems will all tell you the same story. Every day in our hospital system, we see heartbreaking stories of people who end up losing a foot or a leg because diabetes had progressed and they hadn't gotten in to see a doctor. People who have their lives devastated by a heart attack or a stroke that could have been prevented by blood pressure medication, but they didn't have health care coverage. And the number of young people we've seen who are diagnosed with cancer at such a late stage, we can't save their lives, where early detection would have readily solved it. For the longest time in this country, those kinds of services were not available. But because of the efforts of President Obama, Vice President Biden, the Secretary, and our congressional delegation, it's available for the first time. And what we're here today is to say to the residents of Detroit and the residents of the state of Michigan, you don't wait till you have to go to the emergency room and it's too late. It is heartbreaking to see what happens. You can go online now to the healthcare.gov website, or you can call 800-318-2596, and you can get health care coverage now. It'll change the quality of your life. It'll change the quality of this community, and so we're pushing it. And one last note before I introduce the Secretary, because this is something very personal. Back in 2010, when we had arranged to sell the Detroit Medical Center to Vanguard and had the opportunity to bring $850 million in investment into this community, we got held up in a Washington bureaucracy that was almost mind-boggling in the rules. Secretary Sebelius stepped in and helped us resolve that. And because of her intervention, we've got the new emergency room being built at Sinai Grace, the renovated receiving hospital, the new heart hospital about to open at Harper. And so not only has she been the country's leading advocate for the uninsured, but she's been a great friend to the city of Detroit. My friend, Secretary Kathleen Sebelius.
Thank you. Well, I'm delighted to be back with Mayor Duggan in Detroit. I was here, as he said, after he was elected, but before he became mayor. And I think it's fitting, Mayor. The Lions have a new coach. The city has a new mayor. We're on a roll. It's a good day for Detroit. Mayor Duggan knows healthcare. He clearly led one of the large medical systems in the city and saw firsthand what happens when people are uninsured and come through the doors of an emergency room. I'm here to not only say hello to the stakeholder group, which under the mayor's leadership is assembled to really begin some aggressive outreach for the 3 months we have remaining in open enrollment. Open enrollment lasts all the way until March 31st, and we want to make sure that eligible residents here in Michigan know about it and know how to sign up. If you sign up today is January 15th, if folks sign up today, they are eligible for coverage beginning as early as February 1st. But if they're not ready to sign up today, if they need some time to talk to family and friends and take a look at the plans, all the way till March 31st is available. As the mayor said, healthcare.gov is working very differently than it did in early October. Good news. We had about 2.1 million people between October and the end of December sign up for private plans in the health market, 75,000 here in Michigan. And Medicaid expansion is very much underway. And in Michigan, those benefits will kick in the 1st of April. Governor Snyder chose to take advantage of that aspect of the law. We think that's very good news for Michigan residents. But if somebody wants health insurance, they don't have to figure out if they're going into the marketplace or into Medicaid. Just come onto the website, healthcare.gov, and you'll be registered in the program that's right for you and your families. There also are a lot of folks who don't want to just go to a computer. They want somebody to answer questions. They need some help and information. So throughout the city of Detroit, there are lots of in-person options available. Detroit Public Libraries have not only computer access, but individuals to answer questions. Community health centers, and there are great ones throughout the city, like the Community Health and Social Services Center has available outreach and education folks. And the stakeholder group meeting today with faith leaders and education leaders and healthcare providers will have in-person assistance available. And then there finally is a toll-free hotline, as the mayor said, 24 hours a day, 7 days a week, at 318-2596. And if residents call, it's not only available in English and Spanish, but there are translators in up to 150 languages, because we know people may have questions and need information. So I'm delighted to be back here in Michigan. Here's the snapshot of how this can benefit the state of Michigan. Currently, about 14% of Michiganders have no health insurance at all, about 1.1 million residents. 500,000 of those individuals are here in the greater Detroit area. Of those folks, about 93% qualify for financial assistance. For the first time ever, there is some financial help, both in the private marketplace and in Medicaid, to get insurance coverage. And in fact, of the 75,000 who have enrolled, the vast majority qualified for financial assistance. And just to give you an example, family of 4 making $50,000 a year can get covered, the entire family, for $115 a month. It is affordable, it's available, it's often less than a cell phone bill or a cable TV bill for health security for lots of families who have never had that before. So again, I'm thrilled to be here. We're starting the new year with 9 million Americans with health coverage today that they did not have before the Affordable Care Act was passed. We've got 6 million who either are in the marketplace or eligible for Medicaid, plus 3 million young adults who are on their parents' plans, thanks to the Affordable Care Act. And we are thrilled that there are 3 months left to make sure that people get the word that affordable, available health care is at their fingertips, easy to access, and for the first time can give them the peace of mind that they've never had. It's a brand new day, and I'm really pleased to be here with Lanika Wise. Lanika is an entrepreneur and an actress. Given her professional passions, she doesn't have a job that comes with health insurance in her workplace and has been actually uninsured for a number of years. So she was the perfect young, healthy Michigander to look at the marketplace, and I'm pleased she was able to be with us today and tell you about her experience. Lenika.
Thank you, Madam Secretary, for just the great introduction, and thank you, Mayor Duggan, I'm honored to share my story with the great city of Detroit. Well, my story is, at the age of 24, I was booted off my parents' health insurance and trying to find health insurance after that really wasn't quite a priority because I was trying to find my way in life, my career path, what exactly I wanted to do. And so the only options out there for me were like the county's health plan. And with being an actress, my income will fluctuate from time to time. You know, one month I'll be booming, the next month I'm not, you know. And so when I do have the money, I'll get booted off of the health plan. And so I was tired of that cycle, so I just stopped. So for the past 5 years or so, I've been uninsured. And so in October, when the Affordable Health Care had launched, my father, he really pushed me. He said, Lenika, you know, it's all about, you know, preventive care. You're still young, but you don't want to wait to the point to where you feel pain in your body, because at that point it's kind of too late. And you need to look into this. I said, okay, Dad, I'll do it, you know. So I go onto the website, and October there was difficulty getting on. So I put it on the back burner. I'm a volleyball coach, and I also play volleyball. So it wasn't until December I was playing volleyball, and I had an injury. I collided with my teammate. I suffered a mild concussion, and as a volleyball coach, I know the symptoms of a concussion. So I'm like, okay, I got to go get this checked out, but I had the fear of paying that medical bill. And I'm like, okay, do I do it? I said, well, I'd rather be safe than sorry. So I'll go to emergency, get it checked out. But just the thought of high medical bills because I'm uninsured. And so after that happened, my dad was like, you know, Neek, I think you really need to look into the affordable health care. And I'm like, I think you're right. I think that concussion kind of knocked some sense into me. So, and so on December 21st, I went online and I was able to get in. I signed up. I saw that I was eligible for a $211 tax credit. I was like, oh, you know. So I was able to choose a plan that was over $300, and with the tax credit, I walk away paying only $92 a month. And on January 2nd, when I received that card in the mail, that happened to me on my mother's birthday. It was like a fresh of breath air. I just felt like I had a new lease on life. It was like not only it was the new year, but I felt like I could take charge of the year because I have charge of my health. And I don't know, I just feel confident and secure. And I am so grateful and thankful for the Affordable Care Act. Madam Secretary, I appreciate your leadership in pushing this, and Mayor, I appreciate your.
And Lenika, tell them how the enrollment process was.
Oh, it was real simple. You know, I just signed up. It asked me just, you know, questions about my income and what do I expect to make that year, and you know, with being an actress and you know, a coach, I'm like, okay, I'm kind of ballparking it off the previous year. I put in those numbers, and then boom, the next step was like, okay, well, you're eligible for this amount of tax credit. And when I saw that, I'm like, that is the best coupon ever, you know? So, and then after that, then it showed all the different health plans, and I think that's why it took me an hour, because I thoroughly went through all the health plans to see what best fit me, and I chose one with a dental plan, because I'm like, oh, Lord, I don't know when the last time I went to a dentist. But I was like, yes, score, I'm winning all the way around. So when I received that card in the mail, you know, I was calling, you know, my healthcare provider. I'm like, okay, when I'm going to get that first bill, because I need to make sure that I'm still covered. And the lady was like, you're covered, don't worry about it. I guess I just never looked so forward to paying a bill in my life, you know. I'm like, this bill right here, I'm going to pay. That's great. Yeah, but thank you.
Thank you.
Well, and we'd be happy to take some questions if you've got some questions for us. I do want to point out that Lanika not only is one of the 30% of under 35-year-olds in Michigan who has signed up for a health plan, but she also is a great example of young women who now won't be charged up to 50% more than men for a health plan, which has been the case in the past. So it's a brand new day for lots of Lanikas, and I hope you tell that story over and over and over again, because it's very powerful.